Melissa, we've heard that telomere length declines with age. We've also heard that there's a wide variability around the average telomere length at a given age. So at a given age of 60, 65, does telomere length predict survival?
So this is a hot question and there's battling. Let me just tell you, it reliably predicts early onset of disease. There are meta-analyses for most diseases of aging, diabetes, heart disease, stroke. When it comes to mortality, there's a lot that's happening between disease and disease management and when you die. Telomere length is a predictor in maybe 50% or more of the studies. So I would say it is a predictor of mortality, most recently in a study of 60,000 people, but it's variable. And I think once you get to older life, it's a much weaker predictor, over 65.
Let's get back to the economics for a minute, because it seems to me that you're talking about stress. Some of the ideas relate to, violence and a variety of other kinds of stressful experience. But obviously, financial insecurity is enormously stressful, 24/7, I would imagine, right? And one of the effects of longevity is that by the time they're in their 90s, 40% of people in America will have outlived all their personal assets. And they will, in fact, be solely dependent on Social Security because the savings rate in the United States is inadequate. And increases in life expectancy are associated with increases in out-of-pocket healthcare costs, et cetera, et cetera. So Ron, as our local economist, do you have some ideas for what we can do that might work?
Well, I would say we should not weaken Social Security benefits at the bottom of the income distribution. Might make sense to do it at the top. And I would be in favor of adding some a mandatory layer on top of Social Security, but subsidized for lower income people. These things would help people at older ages. And Social Security is great. It's an annuity. It's going to be with you as long as you live. It's as low as you can fall when you run out of your assets and other things.
Another policy that's been discussed is for employers. Many employers don't like these older employees because they're so expensive. Healthcare benefits are so expensive. And if we could go back to the original formulation where if people are Medicare eligible, Medicare pays for their health care costs even if they're fully employed, and the employer is a kind of secondary payer, that makes that employee much less expensive for that employer and might be an incentive to keep people in the workforce and also assist their financial condition. So there's another idea. Any of our panelists have a Pat?
Actually, yeah, I think one of the aspects of that that's really important is related to health, because when people are challenged financially, they often don't seek health care when they could prevent more serious problems later. But one of the things that employers are starting to do now is to think about investing in healthcare as a really good investment. And that goes for elderly populations as well, because a number of things that, if they're nipped in the bud early and attended to in a preventive way, can prevent more serious problems later. Some of the things that models of care delivery that have been pioneered, funded by NIH and others, really are very low-cost interventions. They really simply provide information or access to health care for people to have questions answered, and don't necessarily require their coming in to the hospital, but often eliminate many of those emergency room visits because they don't have to come in if they can get just simple questions answered. So I think a number of these things are very, what they call low tech, but very effective and cost effective.
Thank you. Alyssa, you had a point?
Well, I was going to say, I mean, there is toxic stress and there's not having basic needs met, and then there's slow drip that affects the rest of society. So we saw those income gradients from Adler that Laura Carstensen showed, and so at every level of resources, you see this gradient. And what would really shift things up? I mean, I think we all struggle with this. What are empowering social and economic policies that would help people? What kind of a policy would reduce stress? One of the examples, no one has enough time to, within the unit of a day, take care of all those basic needs. You need to go to work, that takes up most of your day. You need to find time to exercise. If you want to eat healthily, you need time to shop and cook. You need social time, you need to be with your family. Who can fit all of that into a one well-balanced day, day after day? So one structural shift that might shake things up and allow that type of time is a shorter workday. So in Sweden, there are many businesses that have adopted a 6-hour day and have increased productivity and happiness, and now the whole country is shifting to a 6-hour day. What kind of changes could that open up to create? So things like that, that could actually change the ability to bring back the family unit.
But would it reduce income by 25%? If you reduce labor by 25%.
Apparently, we're not really good for whole 8 hours. People are on social media, and there's, people apparently are much more efficient and as or almost as productive.
But another thought.
Try not to point out the complexity of some of these policies.
Think out of the box.
Go ahead.
What else?
But again, things in this society are so uneven. So many people don't have work. Among many groups, there is a kind of a culling of the population prior to age 65. So it doesn't matter what their telomeres have to say because they're dead. Mm-hmm. And one has to think about that. Now, I'm just saying, but it might be helpful if we had a single-payer insurance system and not have to depend upon the vagaries of the capitalistic system in order to be able to do things. That really might allow us to be able to begin very early in life with large groups of people to provide the kind of preventive kind of health care that Patricia was talking about, and I think was inherent also in Alyssa's point with regard to the ravages of the kinds of stress for which some groups in the society have to face. I just think we need to think about it that middle class really doesn't mean average. And when we start talking about programs and policies for that particular group, it's not the average. We have 30 and 40% poverty rates among certain groups in this society right now, which not only impact the adults, but also impact the children who are living in those families that are living in poverty. You don't have to be, a genius to understand if you grow up in a poverty household that your life chances at age 16 are going to be diminished in comparison to someone who didn't grow up in a poverty household. I'm just saying.
Mm-hmm.
Well, let me go back to Alyssa's comment, but before James's predictable applause line about single payer here for this audience.
I didn't know that in this group.
We heard data earlier today from Laura and others that work is good for your brain. That retirement is bad for you. And so we want to keep people in the workforce longer for that reason as well as economic reasons. So while it may reduce stress by reducing hours worked, it may have some other adverse effects. And it underlines for me a lesson I learned from Lisa Berkman, who is a member of the NAM and may be here, and who is a member of our MacArthur network as well. And Lisa, thinking about what people did in policy work in environmental issues, came up with a great idea. And just like whenever a city or a county or a municipality or the federal government is going to do something, establish a policy, have an initiative, there's an analysis of what impact it has on the environment. And it's either good or bad or neutral. And it may be bad, but they still want to do it for whatever reason, but at least they know up front what the impact might be. The environmental impact statement. Lisa came up with the idea of the Aging Society Impact Statement. And that is that every time we have one of these ideas or implement one of these initiatives, somebody should do some kind of an analysis to see what the pros and cons are, to whatever extent we know. A lot of this is unpredictable. And that starts us thinking about the aging society on a regularized basis, which I think would be a very good thing. A recent survey by the Pew Survey Center looked at about 130 countries and asked whether aging in your society is an important problem for your country. Number one on the list, Japan. 86% of Japanese thought that aging of Japanese society was an important problem for Japan. The lowest on the list was Indonesia, where the average age is probably under 50. The next to lowest on the list was the United States of America, at about 26%. So we are in denial. And we need a policy about denial. What?
Well, okay, but in fact, the United States is not going to be aging anything like the way that Japan and most of Europe is. We have higher fertility, and it's just going to well, we're going to age rapidly as the baby boom moves into older ages, but we're going to be settling down at a lower proportion of elderly, a lower old age worker ratio, and so on. I also wanted to say that in Europe, I believe it is part of the European Constitution that any new policy proposal has to be assessed for its intergenerational consequences.
Oh, is that right?
It's not exactly the same as what you're suggesting, but it's related. And finally, I wanted to say in relation to what Elisa was saying, I think it would be a good idea to explore the possibility of spreading leisure, or let's say non-work, more evenly. I don't know why we take it all at the end of life. Maybe there's a good reason, but maybe there's not. And 6 hours when you have young kids and more hours when you're 70, might not be so bad.
Completely. And if you think about what we're doing going forward, we're going to, for most of the population, or much of it, we're going to increase active life expectancy. So what are we going to do? We're going to bolt that onto the leisure part of,
That's what we've done so far.
the life course? That doesn't make any sense at all, and we can't afford that. So that's another reason to develop these models that integrate work, leisure, education throughout. The way I think about it is instead of these blocks that when you go to the seashore and you see these little sand things with different colors sands going along, horizontally, that's what we need. We need, work to tail through, and education to tail through, and leisure to tail through, rather than these blocks of these homogeneous colors. That's as far as I've gotten with the analysis. We're going to go to the microphones now. We have about 10 or 12 minutes before we hand the gavel over to Victor. So please introduce yourselves, and let's limit it to one question per person, if we can. Yes, ma'am.
Judy Stern, UC Davis. I'm not speaking to the neurosurgeons, but what if we put a rule into place that no physicians could make $1 million or more? That the physicians that should make the highest amount of money are the general practitioners and the nurses, because they work with people and they have contact with people. Would that
Thank
work,
you.
in quotes?
Thank you very much.
Well, there'd be no opposition to that one, right?
We're going to present that proposal at the neurosurgery meetings. And
real
does
troublemaker
anyone
here.
dare touch this, or should we go on to the next? No, we'll go on to the next.
I'm not going to
Hey,
argue.
what's there to say?
We support it, Judy.
Oh, we'll go over here.
David Spiegel, Stanford. As a psychiatrist, I'm not worried about having my salary capped at $1 million. Thank you. I'm thinking about what we heard earlier about hippocampal plasticity, and I think we've heard the dark side of telomere shortening, but I wonder, Ellis, if you could talk a little more about the brighter side, which is there are studies, you've done them, showing that telomere length, even in mid or later life, is related to stress. There are studies that show that mindfulness may actually extend telomere length. So what would happen to telomeres if some of the policies suggested to reduce financial and other stressors later in life were put into place?
Thank you.
Thanks for asking it, David. I'm a big believer in using biomarkers of aging as barometric meters for our interventions, because then we can look at these in children and in young people before people develop disease, and are we slowing the rate of aging? So it's really different. If we can grab onto biology of aging in a better, more measurable way, we can manipulate that and not worry about the thousands of complex disease pathways that develop later, because the biology of aging is less complex than the biology of specific diseases. It's common. That's my point. So to answer your question, there is a brighter side, and there are many interventions now that have been done on stress reduction, looking at telomerase or telomere length as an outcome. And there's probably publication bias, but so far all of them look really good. And there are increases in telomerase after several months. There are even increases in telomere length in active groups that are doing different stress reduction activities. One is emotional expressive therapy in breast cancer patients that, thanks to you developed 20 years ago. Another is mindfulness meditation. There's a new exercise intervention out of the UK that compared weightlifting to endurance to interval training. And the weightlifting didn't do much, but the interval training and the endurance training boosted telomerase a tremendous amount. And now Liz Blackburn's going to look at the telomeres, because we've ignored telomeres in all the short-term interventions thinking they don't change, and they absolutely do. They change within weeks to months. So it's a whole new, easy to add on biomarker, and there's a lot of hope that there's some plasticity.
Thank you.
Thank you.
Thank you very much. Yes, sir.
Bob Brook, if I were a Martian and I was looking down at Earth, I would look at golden retrievers in the backyards in Beverly Hills, and I wonder what they do to deserve the life they get. And then I would look down at elderly women that are warehoused in nursing home duplexes with nobody caring, and are really invisible gorillas, if you've ever read the book, and are treated with minimum wage people, whether at home, socially isolated, and treated terribly. And then I would ask the biologists whether they're going to solve that problem in 20 years, and I've listened pretty intensely today, and the answer is maybe in 50 years, but not certainly in 20 years. So from a policy perspective, is there any hope that the next 20 years of elderly women are not going to be treated the same way that we're treating them now?
Well, he knows what my answer is, so I won't even answer. Maybe somebody else would like to answer that.
We want to hear it, James. Go ahead.
Oh, no, well, if we don't do anything, then indeed the future looks exactly like what it is in the present. And we already know that chances are the kind of people that Patricia was talking about who are going to be providing the caregiving and other kinds of issues are going to be low-wage minority workers who are not only providing the care with regard to non-Hispanic whites who have the financial resources to pay for it, but they're also going to be providing the care for their own families. Completely. And so you're talking about stress that are coming for this particular set and group of people. It's going to become even more pronounced.
Yeah, I would just echo that, and just to move along here. We haven't discussed workforce very much, but the long-term care workforce is obviously inadequate. Often not trained well enough. In the state of California, you need more hours of training to be a crossing guard than you do to be a home health worker. And the increase in the population of people needing these services is going to far outstrip the capacity of the current expected workforce to provide those services. The IOM several years ago had a study on retooling the healthcare workforce for the aging population, which got a lot of attention. And there's been some progress in some states. And there are some parts of the Affordable Care Act that were actually recommendations that were in that IOM report. But we are far from being adequately prepared to provide the services that are needed. Far from being adequately provided.
Jack, can I just ask a question for 1 second on that? I agree with everything
This is the second part of your first question.
I'm just going to say the same thing. Without a different moral compass, will any of those technical solutions solve any of the problem?
Yeah.
I really believe we have a society that does not like elderly women. And they don't care for them, and whether they're minority, whether they're ex-college professors at UCLA, that we have produced a society that is just malicious to elderly women. And the question is, are we prepared to do anything about it? That's all I'm saying. Technical issues might help.
Thank you. Yes,
So I
ma'am.
think that's the most pernicious piece about the denial in our society about aging. I think that having forums such as this to focus on the issue and to the ramifications of it are particularly important. I think when you look at some of the studies that we funded and NIH has funded and AHRQ have funded, and you look at the workforce issues, what you see is that there is an increase in morbidity and, yes, mortality related to the number of patients assigned to a particular health worker, the educational level of that health worker. So that's all documented. And so it is really, for those of us in the audience looking forward, it's a very frightening thing. And so something does need to be done, or it won't matter, because the people who are most effective will not be here to vote on that or to weigh in on it, as it were.
Thank you, Pat. Yes, ma'am.
Brenda Cleary, and as an RN prepared geriatric nurse, part of my career has been spent in long-term care facilities doing research and practice. And this is kind of my good colleague Pat. I agree with you that aging in place is what baby boomers want, and I think a majority of us will be able to get it, especially if it's enhanced by technology. But there's a smaller minority people that I don't think can do that. That's people who are very frail, or they're in the middle or end stages of Alzheimer's or other dementias. So I think we just have to have something running in the background, that we're looking at new prototypes for long-term care quality in case someone, either a caregiver, can't do it anymore, or someone, it's just not safe. So that's just what I wanted to comment on.
Thank you. Yeah. Okay, we got 3 or 4 more, and then we're going to be finished. Yes.
Oliver Fine from Weill Cornell in Manhattan. I want to thank Dr. Jackson for bringing up the issue of single payer.
Yes.
And I was interested in our economist's response to that as a way, of really saving costs within the healthcare system and potentially redistributing them to, for instance, childhood education.
Are you trying to cause me trouble here? Is that what you're trying to do? He's bigger than I am.
Do you have a comment on single payer?
Dr. Lee.
No, it's outside my area, but I'm all for it.
This is a recurrent applause line. Dr. Berenson.
I did tell you he was a great economist, too.
Okay, yes.
Yeah, hi, Jim Harris from Johns Hopkins. Since this section is called interventions, I'd just like to raise a question. It's largely for Dr. Eppel. Basically, it seems to me that there are 3 areas that we need to emphasize. One is immunization, and we haven't talked about immunization against amyloid in Alzheimer's disease. The second is chemoprotection. Paul Talalay has a program at Hopkins, and we know about increasingly that sulfopain, for example, from broccoli shoots, and is a compound that helps with DNA repair and works in cell culture and in mice. So we heard earlier today a comment about the massive amount of antioxidants that are pushed, particularly omega-3s and so on. So it seems to me it's a societal issue in terms of the not only looking at these other strategies for Alzheimer's, but looking at chemoprotection as an intervention. And the third thing is what Dr. Eppel said, and I read her paper with Dr. Blackburn on mindfulness meditation increasing telomerase. But the other element in this is the physiology of social engagement and oxytocin and its importance in confiding relationships, in child care, and in bonding. Because oxytocin is an anxiolytic compound, and I expect that social engagement is emphasized in the solidity of society will make a great difference, and that the mechanisms that lead to telomere length could be enhanced by looking more carefully at both mindfulness and loving kindness meditation, which have both been correlated with increased telomere length.
Thank you. Do you want to comment very quickly on that? We've got 2 more.
Very quickly, I think that we need to think of, rather than just precision medicine, precision prevention, and there's a whole battery of strategies, many that you mentioned. They're behavioral, psychological, as well as supplements, chemoprotection. No one wants to touch pills. They haven't been studied. We don't know the biology of aging. But if we actually put some money there on prevention and enhancement of health to prevent disease, that means pills too, not just lifestyle, then I think we'd be in better shape.
Okay, last two comments. Yes, please.
Hi, Dana Matsby from the University of Colorado. In policy circles, the understanding I have is that the gap between non-white Hispanics, African Americans, Latin Americans, et cetera, and whites increases over the life course as people age. And in our circles, I'm trained as a lawyer, one of the more difficult conversations is about how much of that is attributable to health behaviors, lifestyle, culture, and the pernicious version, personal responsibility. So I wonder if you could comment on that widening of racial and ethnic gaps as it intersects with stress.
Okay, I'll ask Ron. I was under the impression there was actually kind of a crossover effect, and that the life expectancy at age 65 or 70 of African Americans was not as many years less than of whites as it was previously, maybe because of selection and early mortality effects. So Ron, what is your understanding?
I don't have a clear answer, and I wonder if James has something to say.
I could have given that talk. I didn't give that talk. I think...
don't give it now, James.
No,
2 minutes.
No, I won't, because we only have a couple of minutes. But that's probably true. Remember, if we take a look at what people's life trajectories are, I was making the point that the better your start, then the better the actual trajectory that you have. The poorer the start, the more problematic. So if you belong to groups whose treatment and other kinds of life experiences are more negative than other groups who are more favored, then you would expect to see exactly what we do see, which is a widening of the gap.
What about this crossover?
The crossover, actually, as I've talked about in my work, the first crossover takes place before 1 year, 1 age of life, where a selection process takes place with regard to African American children. And the weaker die out, leaving a stronger group behind. That moves into middle age and becomes very stressed. That indeed is another culling which takes place, particularly over middle age and early old age, which leaves behind a stronger group. But that number is about 83 now, I think, where we get the crossover. So my thing was always, boy, if I can just get to 83, and then I'm going to be home free.
Here's the last comment.
Hi, I'm the person you've been talking about. I'm 93 going on 94.
All right.
I'm also an emeritus member of this organization and used to be very active here. But I talk about aging by choice. We need to give some self-responsibility, and that's through education. We need to educate this aging population that there's so many things they can do about it, rather than just it's another pill or another doctor. We have some way or other to give some of that sense of responsibility. I've been, for 75 years, we have a place called Rancho La Puerta, fitness resort. And we make people fit. But you all make people healthy, but they have to learn to do it on their own. You need to help educate them. It's really important.
Thank you very much.
Thank you.
And thank you to the panelists, and thank you to the audience for participating. Thank you.